Nakshatra. Today we are going to learn about nervous system. In our previous video, we have learned about four major systems of our body. Respiratory system, circulatory system, digestive system and excretory system. So today we are going to learn about nervous system. So without further delay, let's get started. What is nervous system? The network of nervous cells and fibers which transmits nerves impulses between parts of the body is known as nervous system. So let us see the diagram of nervous system. So this is the brain. The brain has wrinkles in it. The more wrinkles we have, the more intelligence we have. And this stick-like structure is known as the spinal cord. And these yellow color fibers are known as nerves. Actually, the actual color of the nerves is green. So, now let's learn about organs of nervous system. We have three organs: brain, spinal cord and nerves. So, let's see detailing about them. Brain, a mass of nervous tissues that is present in our head which helps us to think and enables our feelings. Spinal cord, a column of nervous tissues that runs from the base of the skull down and the center of the back. And these nerves, as we saw these yellow color fibers. A vessel of fibers, a bundle of fibers in the body that transmits impulses of sensation to brain and spinal cord. So, hope you understood about organs of nervous system. Now we are going to see a new term. New term is stimulus, to respond to. For example, think you have a hot surface, like a hot water glass. When you touch it, you immediately take off your hand. This is because our brain sends impulses through the nerves to take off our hand as it's hot. So, this process is known as stimulus. Diseases of nervous system: Alzheimer's disease, dementia, brain cancer, epilepsy and other seizure disorders, mental disorders, Parkinson and other movement disorders. Like movement disorders means you can't move your hands or legs. Stroke and TIA, transient ischemic attack. So these all diseases are brain diseases. Now we are going to see about diseases of spinal cord. So diseases of spinal cord is tumors. So tumors is a growth in your spinal canal or the bones between your spinal cord. Spinal stenosis. So spinal stenosis is a narrowing of your spinal cord. Herniated discs. So herniated disc is that your nucleus pushes through the cracking annulus. And this abscess. Abscess is a pus or painful connection of pus by the bacterial infections. Hematoma. Hematoma is a common disease happens every day in our lives. Like there is a break in your larger blood vessels or your larger blood vessels are not working. Vertebral fractures. Vertebral fractures, by this name itself you can understand what is vertebral fractures. You will just get a break in your spinal cord and with some plaster of Paris and you can fix it off. Degenerative disc disease. This is the most common disease happening in everybody nowadays. So degenerative disc disease means that your bones wear down and you can't get up or sit like normally or walk. You'll just be flat. So treatment for brain disease. Actually, there is no cure for brain diseases. Only you can maintain your reduce symptoms or maintain your quality of life by using some treatments. So treatments means like medications or injections. So treatment for spinal cord. For treatment for spinal cord is corticosteroids. So corticosteroids is a type of medication that can help minimize damage of your bones. NSAIDs. So it's non-steroidal anti-inflammatory drugs. Next we have antidepressants, anticonvulsants and opioids. It's also known as narcotic analgesics. Muscle relaxants, antibiotics. Antibiotics is mostly used in these days, but these treatments also can help a lot. Symptoms of brain diseases. So symptoms of brain diseases is a loss of conscious, seizures, vomiting, balance or coordination problems, serious reorientation, inability to focus the eye, or abnormal eye movement. You continuously do like this. Abnormal eye movement and a loss of muscle control. Symptoms of spinal cord disorders. So spinal cord disorders are problems in walking, loss of control of bladder or bowels, inability to move the arms or legs. You can't move your arms or legs, or you can't walk. Feeling of spreading numbness, unconscious. You always lay sleeping. A headache. You'll feel a headache over in your forehead or these. Pain or pressure or stiffness in back and neck area. When you try to sit, you feel some pain or pressure in your neck area and back. Signs of shock. So we are going to learn preventions for brain and spinal cord disorders. So prevention is better than cure, as you know. So for brain diseases prevention, get regular exercise. Control your risk for heart problems, because you have to control your risk for heart problems, because heart only pumps blood through all the body and your brain receives blood from heart. So if you get any heart problems, it's like a big loss to your brain. Manage your blood sugar levels. Avoid all types of head injuries like hitting your head to wall or falling from bike. Limit stress and get sleep you need. Protect against hearing loss and also social isolation. Reduce or stop using certain medications, like some brain affecting medications. Spinal cord. So for prevention for spinal cord, always wear a seatbelt while you are driving in a car. And one more thing, that you have to wear a helmet when you are driving in a bike, because if you fall down, you won't get any hurt to your head. Never drive a motorcycle or a vehicle under influence of alcohol or drugs. Keep a clean home, and never text or use phones or get distraction when you are driving a car or a bike. Always see your road, because some people would be texting in phones and taking selfies. Keep a clean home, because if there is any water in your home and you kept your leg, and you will slip off, and it can also cause some spinal cord injuries. Never move someone who suspected spinal cord injury or has spinal cord injury, because it can ruin their bones. So now facts about spinal cord. So this is the brain, as you know. This is the spinal cord. Our spinal cord is divided into 5 types of bones: cervical, thoracic, lumbra, scrotal and coccygeal. So this is cervical. Cervical is divided into C1 to C8 bones. Thoracic is divided into T1 to T12 bones. This is the longest bone. Lumbra is divided into L1 to L5 bones. And scrotal is also divided into S1 to S5 bones. Thank you. Hope you understood my video. If yes, please like, share and subscribe to my channel. If you have any doubts or need more lessons, please comment in the comment section. Thank you.